I'm Clare Sansom. I'm a Code Fellow. In fact, I've been a Code Fellow since two, 2005. So I'm coming up to 20 years of involvement with code, obviously. For a lot of that time, we were the Centre for Distance Education, or CDE. I'm work as a lecturer, mainly online at Birkbeck and at the Open University, where I teach mainly, but not only, in biomedical sciences. And I've worked as a consultant for quite a number of places. And I also do freelance writing. If you've read the the blogs of any of these, you'll probably have seen my byline. Before I introduce today's speakers, though, I would actually like to apologise for my voice. I do have a bit of a cold, so if I suddenly go mute, you'll have some idea why. I can assure you it's not COVID, not that COVID or anything else can be caught on Zoom. So today we're going to be discussing the very important issue of online and digital education in the medical sciences, and specifically, but not only, in clinical medicine. We've got two speakers from London. We have Chie Adachi from Queen Mary, and firstly, we have Clare Rogers from the London School of Hygiene and Tropical Medicine. So, well, the way that the session will work is each of the speakers will present for about 20 minutes. We'll have one or two questions after each individual talk, and then after both presentations, we'll throw the discussion over for general questions and general discussion. So, without more ado, I will introduce Clare Rogers. As I mentioned, Clare is working at the London School of Hygiene and Tropical Medicine. She has worked there for over 30 years. She's a principal biomedical scientist, and she heads up the teaching and diagnostic unit in the Faculty of Infectious and Tropical Diseases. And she's going to talk about how, during and after the pandemic, she transformed one of the LSHTM courses, the Professional Diploma in Tropical Nursing, from a hands-on short course for nurses into a fully online one, and how this has enabled the course to develop not only during, but also since the pandemic. So, without more ado, I will hand over to Clare.
Thank you very much, Claire, and thank you for welcoming me and inviting me to speak to you. So I'm going to share my screen. So just bear with me for 1 second. Okay, so hopefully everybody can see the screen. So I've called this Keeping It Practical because I'm co-organiser of the Professional Diploma in Tropical Nursing, but I have specific responsibility for the practical side of it, and that's what I'm going to talk about today, really. So the PDTN, so the Professional Diploma in Tropical Nursing, prepares nurses and allied medical professionals to work in low-income settings and make significant contributions to world health. It's a course recommended by MSF, Save the Children, VSO, the British Red Cross and other international agencies, and it's actually a prerequisite for nurses and allied medical health professionals before they get deployed. So it's a well-known course, and it's been running really since 1950. So in 1950, it started as a certificate in tropical diseases, and this was undertaken by the nurses on the wards at the Hospital for Tropical Diseases, which was then at St Pancras. The school became involved in the 1980s when we started providing laboratory practicals, giving a kind of more of a sort of hands-on biology feel to the course. And then in 1996, it became the Professional Diploma in Tropical Nursing and well established at the school, headed by Dame Clare. And we are still doing pretty much the same today, except for being online. So we have 130 students every year, 2 intakes, one in March and one in September. It's a part-time course, 1 day a week for 19 weeks, and students have 7 hours contact time, which includes a 2-hour laboratory practical and 8 hours of self-directed study. Now, 80% of all our students are working full-time. Most of them are self-funding. So this is a really important course for them. Many of them go overseas after completing this course. So what do they study? Well, they study a huge broad range of subjects, from Ebola to ethics to climate change to tuberculosis, population and contraception to dengue, care of war wounds, you name it, it's included in their syllabus. And it's all aimed at allied health professionals that are going to go out and work in resource poor settings. Now, that might be in LMICs, or it might be in conflict zones. So there's a broad range, and they get to study and meet experts in the field in all of these different subjects. Now, the laboratory is all about the application and understanding of laboratory methods that they might come across at district level clinics in these resource poor countries or resource poor situations. So we look at the diagnosis of infectious diseases and other medical conditions, and we try to teach them about how they might manage patient care given the results of these diagnostic tests. So we teach them how to use and maintain a microscope, how to prepare and process blood films. We tell them about normal blood and how abnormal blood might look down a microscope. We teach them how to recognise and differentiate the species of malaria. They recognise and differentiate other blood parasites like trypanosomes. They can recognise leishmania in bone marrow aspirates, for instance. We look at feces, and they get to differentiate Helminth ova, so hookworm ova maybe, or Schistosoma mansoni. They can differentiate protozoal cysts, so Giardia is a good example. We then teach them how to perform an emergency ABO blood grouping and cross-match, how to prepare and stain sputum smears for mycobacteria. And then we also look at point of care tests, for instance, hemoglobin estimations, and other things like malaria rapid diagnostic tests. In terms of assessment, the students do a written assignment. Now, this 2,500 page assignment, no, 2,500 word, that'd be a bit too many, wouldn't it, pages? Word assignment is of a subject of their choice. And you can see from my examples here, very wide ranging. Climate change to traumatic stress disorder to the human rights of mental health patients. They then sit a multiple choice question paper, which covers the sort of lecture material, and they actually do a laboratory exam as well. So that's the course, and that's how it's been in that format pretty much since it came to the school. The practicals. Well, this is where we consolidate the learning from the lectures. We want to teach them basic laboratory skills. That's why we focus on the microscope, because in the resource limited settings they may find themselves in, chances are there will be a microscope. We want to improve understanding and awareness of lab diagnosis, you know, how important it is to send the correct sample. What does the result mean? What are the limitations of the tests? We want it to be interactive, want it to be hands-on. Now, many of our students will never, ever go and look down a microscope again, but we want to give them a broader understanding so that they understand the kind of relationship between the clinic, the ward, and the laboratory. And of course, any practical work, it's fun. So you can see from our student feedback, the lab has always been a really popular part of the course. I love the lab sessions and how interactive they were. And nurses and other healthcare professionals are often surprised by how much they enjoy the lab part of the course. For many of them, it's really, really outside their comfort zone. They are often surprised by how much they learn. So, for instance, as one student says, from knowing not how to turn on the microscope to diagnosing malaria, 3 short months, it's amazing. And it is amazing. They are amazing. But then in March 2020, 2 weeks into our course, the world changed. And UK went into its first lockdown. So 2 weeks into the course, what were we going to do? Did we want to stop, or should we try and complete the course, but in an online format? So that's what we did. So within days, we did a rapid transition online. We set up or kind of elaborated on our Moodle page. We all learned how to use Collaborate, and then what followed was Padlet. We introduced weekly informal meetings online at 8:15 and at 5 o'clock. We sort of made more sort of contact with students. We made it easier for them to contact us through WhatsApp, through email, through one-to-ones on Zoom. And we started to teach online. However, the big problem, of course, were the practicals. How do you teach practicals online? Now, some years ago, I was involved in the distance learning course in our MSc in infectious diseases, and I co-wrote a module on diagnostic methods. And one of the things that we all felt was we just couldn't do it justice without that hands-on interactive part. So how are we going to give these nurses their practicals? It's not unusual that we find technology enhanced learning in healthcare education. Okay, for years we've been using simulators. So for instance, in dentistry and in surgery, we're already using high-tech methods to teach students in healthcare. Slide scanners in digital pathology, they're commonly used so that histopathologists can share slides, they can look at material together and diagnose diseases. There are virtual microscopes. It's not unusual. We looked at these resources. We looked at other things. YouTube, you can learn anything on YouTube, pretty much. There's going to be a video about it, from looking down a microscope to staining smears. There are lab simulation software packages. Okay, so LearnSci is one. This is software which enables you to teach your students about, here I'm giving an example, safety features. You can use it to teach students to handle a pipette, to load gels, to run PCRs, to street plates, you name it. You can use these kind of lab simulation software. There are virtual lab notebooks, to enable you to interact with your students. And of course, in terms of teaching students to recognize organisms, there are a gazillion online images. And we looked at all of these. However, we felt that the lab simulation software was aimed largely at undergraduates. It was very broad. It was not really specialized enough for what we wanted. It really wasn't appropriate for our syllabus. Images, well, there's good and bad images out there, I have to say, but they're not really a substitute for looking down the microscope. Scanners, well, they're great for the purpose they're designed for, but they're just not suitable for our specimen types. So it became clear that we were going to have to do something more bespoke. We were going to have to produce something ourselves, essentially. So what did I want to achieve? And I had a very clear sort of vision of what I wanted to achieve, really. I wanted to keep the feeling of being in a lab. That was really important. I wanted to make it really, really interactive. And I wanted to maintain the continuity. We'd had 2 weeks, the students had been in the lab, and I wanted to maintain that feeling. I wanted these students to feel like they were continuing the course they'd signed up for. Now, of course, we have to remember that these students, predominantly nurses, were dealing with a situation of the pandemic and COVID, in their workplaces that may not have been so conducive to studying. And many of them did have to stop and defer. They just couldn't carry on. So there was a lot of things going on in the background. And I wanted this to be what they'd signed up for before this had all happened. So I had a really sort of clear view of what I wanted to do. So we looked at lots of options, and our TEL team here were enormously helpful. We looked at ways I could make the material interactive. That's what I wanted to do. How could I do that? We looked at H5P, we looked at Sway, we looked at using Moodle quizzes. What I did was I took lots of high resolution images. I used our existing microscope and digital camera system. I took lots of videos of the view down my microscope. So I examined blood and feces and sputum smears. I took videos of various techniques, how to set the microscope up, how to stain, how to do a blood grouping. And if there was one sort of bonus of it being during the pandemic, was that because the other half of my job is running a diagnostic lab, we were still working. So I had the material at hand. I could take the pictures. I could do the videos down the microscope. Otherwise, I don't think any of this would have happened. So we decided to use H5P at this platform to create these interactive sessions, which we called virtual practicals. So the virtual practicals, we decided that keeping the format of the face-to-face practicals was a good way to go. It kind of gave us a kind of established format. So in the face-to-face practicals, and of course in our virtual practicals, we start with an introductory lecture. Now that depends on what the subject is, but it could be, for instance, if it's malaria, me talking about how we prepare blood films to look for malaria, the features we look for in a blood film, the importance of staining, and then going on to describe the differential features of the malaria parasites. So the students appear there. That's a live session, a synchronous session. It is recorded, but as many students as possible came to the live session. We then, at the end of the session, made available the virtual practical. So this was the H5P practical, okay? And now this was asynchronous. It was for them to complete at a time that suited them. Interspersed over the weeks, we did some revision spots because that had been a really good way of revising during our face-to-face practicals. We did some question and answer sessions, either at the end of the introductory the talk or as a separate session. And of course, we had to do an online exam, which we based on the face-to-face format. So what I wanted to do was use the H5P platform to produce a number of interactive activities that would teach the students how to process and prepare specimens, how to examine those specimens, and how to diagnose the infectious organisms. And I did it by using a number of different sort of activities. So, for instance, how to set up a microscope. So the students watch a video of me setting up a microscope, and then one of the activities was labeling the parts of the microscope using this very simple, just dragging and dropping and labeling the parts. Similarly, identifying this helmet egg in some feces, okay? So they get a selection of possible eggs and they drag the correct answer into the box. I liked these. This was like a flashcard. So we did normal and abnormal blood on flashcards so they could do it again and again and again. And then this one for the malaria parasites was fill in the gaps. So basically, what's your diagnosis? how do you reach that diagnosis? Tell me what features you see that make this, in this case, a Plasmodium vivax parasite. Lots of videos of the techniques. So, you know, this was staining for TB. And then we had those sort of views down my microscope where I commentated on what I was seeing as we watched the video and used the kind of interactive features so I could kind of pinpoint particular cells as we went along. At the end of each virtual practical, we had some summary questions just to kind of consolidate what we'd learned. And then, as I said, we had some spot sessions, so 10 unknowns for students to identify. Now, one of the things I really liked about the H5P platform was that it gives you immediate feedback. So, for instance, students have to identify this microfilary, and in this case, although they've identified the differential features, they've got the wrong microfilary, but they can see that straight away. So this immediate feedback is much more like being in a face-to-face scenario. Okay, so it's very immediate. They can see they've got it wrong. They've got the right idea, but they need to rethink their answer. And at the end of the H5P session, it allows you to see how many you got wrong or right, hopefully, overall. And you can see the answers, and then you can retry it, clears all the answers, and you can have a go again, either straight away or use it for revision purposes in the future. So I really liked this because this felt like students could review and assess how they were getting on. They'd get instant feedback and hopefully would see an improvement over the weeks. So it worked well. Phew. They loved it. They loved the lab sessions. They liked the way we were doing the lectures, the independent study, the spots tests, the self-study. They liked the fact that it felt they were in a lab, which is, of course, what I wanted to achieve. So we were really, really pleased with the feedback. However, alongside the good, of course, comes the not so good. And one of the issues was this, that although, as this student says, the teaching of the virtual practical is very, very good, the video was very, very slow. And in fact, had been really difficult to upload. And again, another student had unresolved issues, you know, tried different browsers, upgraded the operating system, and still couldn't watch the 5-minute video. So this was, you know, and still is an issue. It wasn't the only challenge. So the first challenge was the time scale. So we decided we were going to put it online, but I didn't have any of this material available, so I needed to put it all together in a reasonable time. So in the end, we had 6 weeks. We sort of shuffled the timetable around, and I had 6 weeks to kind of get that all together, given that we were still working in the diagnostic lab and I needed to sort of amass the information. But the real problem was I had no idea what I was doing. I could barely use Zoom. I mean, it was really, you know, I had no previous experience. So it was a little bit like learning on the job. And unfortunately, because we were in lockdown, we didn't have any equipment or on-site support of that kind. I certainly had support online. The TEL team were fantastic, but there was nothing here. So I had to do all these films. So what did I do? Well, I got my iPhone out, obviously, and I did the films on the iPhone, filming all the techniques on one or more iPhone. I then taught myself how to do video editing. iMovies is a wonderful thing. I learned how to overlay videos. I learned how to do, you know, record a voiceover. And my pièce de résistance is what I'm showing you here, where I used 2 iPhones at the same time, recorded from different angles, and then put that all together, did a voiceover, and also included a little sort of window in the corner of the view down my microscope. I have to say that was probably the pinnacle of my video editing. But one of the issues was the file size. Now, the images down my microscope had very high resolution, and the idea is that the students can see it, but they're huge size files. And that has been an ongoing problem of how we can get them uploaded onto the Moodle platform, how we can, compromise between the resolution and the size of the file. And that's, I mean, we've had occasions where one of my practicals just kept crashing Moodle because it was so large. So I've learned to compromise a little bit on the resolution and sort of make smaller presentations. And it was a bit like sort of learning as you go. Some things worked, some really didn't. The end user internet is it's not something we have any control over. We do tell the students what they'll need, but sometimes, particularly if they are in an LIMC, they may not have very good internet connectivity. So this is an ongoing issue. And of course, as with all online exams, this is where we have a real problem, because the PDTN has always had an open book exam in the laboratory. Well, of course, online, we've got open book, open internet, open everything. So it is difficult. And I think that's the same for all online exams, to make an exam that is fair and equitable and that tests the students, but, allows for the fact that they can look everything up online. So the PDTN now, well, it's remained online. It worked well. And now we can attract students from all around the world. Previously, it was UK-based students and some from sort of fairly near European countries, but now we're sort of global. And really, really importantly, we are providing postgraduate education to students actually in those LMIC countries, and we are offering scholarships for some of them as well. So we feel like this is such a positive step towards decolonising global health. It's been really, really very positive. So what have I learned about digital learning? Well, for me, what I've learned is if I'm thinking about practicals, which is what I do, then we have to keep it interactive and it needs to be engaging. And to keep it engaging, there needs to be a variety of different tasks and activities. Self-assessment and review is critical with that instant feedback. I think that's so important. One thing I did learn was it didn't need to be complicated. I was so worried at the beginning that what I was showing was a little bit simplistic, but actually speaking to the students, they love it. Who doesn't love a computer game, eh? So they really like the fact that it's different sorts of quizzes and it's suitable for what they need to learn. So yeah, I didn't need to worry so much. Continuity and a personal touch. I wanted there to be continuity from the first 2 weeks. So that was important, but it's also about continuity through the course. And the students tell me that they like the fact that I turn up every week and we have this face-to-face lecture and they can ask their questions. And then when they watch their virtual practical, it's me doing the voiceovers and it's me showing them the techniques, and they like that because it feels like it's more personal for them. So in that sense, the continuity works. But of course, with all online learning, maintaining the sort of feeling of community is really important. And we try to do that with the kind of Q&A sessions and sort of bringing everybody in, but also recognising the individual students. So from my point of view, that's answering emails when they send me a little screenshot of something they can't get to work. Okay, so doing both, making them feel important and special and that they have that rapport and that relationship with you as the tutor. So in conclusion, does it replace the wet lab? This was what we were trying to do. Well, for the PDTN, it achieves the intended learning objectives. I have since used this material and obviously embellished it for other online practicals, certainly over COVID during the pandemic. But since then, it's very useful for preparing students before practicals. They can have a look at how you set the microscope up before they even set foot in the lab. And it's incredibly useful for revision. I have a whole suite of revision material that we give to our master's students. But I leave you with these thoughts and comments from our tropical nursing students. Please put the labs back in. I waited 10 years for the course, and it's the thing that broke my heart. Well, I don't know. There's pros and cons, I would say. So a few acknowledgements. So Dame Clare, who's now retired from the tropical nursing, who was really supportive, and the pair of us really didn't have a clue what we were doing. So really, thanks to her, all the staff in the diagnostic unit, of course, for the specimens, of letting me film hands and them doing various techniques, and our fabulous IT services here, who were so supportive for me, calling them up at all hours of the day and I emailing them when I couldn't get things to work. Thank you.
Okay, well, thank you very much. That was fascinating. There are lots and lots of questions in the chat, most of which I think we can leave till the general discussion at the end. But perhaps you could answer some of the questions that I can put together about videos and bandwidths. People suggesting that the videos might be to put on YouTube, whether they could actually be replaced by still images to save bandwidth, or alternatively chunked into small pieces so that they could be uploaded more easily.
Yeah, yes. We didn't do the YouTube, but we certainly discussed that. We using images, separate images is something we can do. And certainly I have done like slideshows of, various images. So for instance, when I teach students to do a parasitemia and malaria, we do that. We do like, you count these 8 fields. So it is just that, but it doesn't replicate that feeling of looking down a microscope and spotting the parasites, because essentially what you're doing is showing them the parasites. So in that sense, the separate images, we do use them, absolutely, but it's for a different feel, really. If you're trying to get or teach someone to recognize what is and isn't an egg in amongst lots of fecal debris, then they need to be it needs to be moving. Chopping them up is certainly the way I have done it. That seems to be the best option at the moment. But yes, it has proved tricky, very tricky, and I've spent many a sleepless night worrying about my videos.
Thank you very much, Claire. That's all very helpful. There are still some fascinating questions in the discussion, but I think that it's time to move on to Chie. I hope I've pronounced that correctly. Chie joined Queen Mary University of London in 2022, coming all the way from Deakin University in Australia. At Queen Mary, she works as Dean for Digital Education, leading an interdisciplinary team of digital education professionals in the digital education studio. And she's going to talk considerably more generally about how she's been leading innovation for digital health education in the whole of the sort of Queen Mary sort of departments of medicine. And so over to Chie.
Thank you very much, Claire, for that kind introduction. And can I just check that people can see my slides on your screen?
Yes.
Excellent.
Yes.
Thank you. So just to comment on Claire's talk, thank you so much for sharing your experience and insights through the experience of transition to online. And I think your case is a stellar example of how people did innovation through the pandemic, a time of crisis, because they were forced to think differently. And my context is that I'm going to take you to the sort of more macro level of innovation. So sort of provocating what innovation really means in the context of digital education for higher education, given that Claire already shared a sort of macro level of innovation, what can happen in a module and a unit design. Now, the role that I hold as a Dean for Digital Education within this Faculty of Medicine and Dentistry is a relatively new one. And so I came in post-pandemic, having done this kind of work around digital education for quite some time in Australia as a Director of Digital Learning at Deakin University. And so it's thinking about the context in which innovation happens and the innovation rhetoric that comes often with digital education, because, of course, the use of technology brings innovation or not. And how do we think about that is the sort of essence of this talk today. So just to acknowledge the team that I work with, Digital Education Studio at Queen Mary, most of the talk of examples that I share today is not done in isolation. All of the work that I do is always in collaboration with others. And these are the people that I closely work with currently, and including some of the leadership group of this faculty and the university. And so in setting the scene, we are living in this post-pandemic, post-digital world where innovation and technology are all around us. And I think through the pandemic, we learned a lot of the things, including great innovations that Claire just shared. But there are certain things that we want to also leave behind because it was done in a rush and we didn't really have good moments or lengthy period to really think what that looks like. And now that AI, ChatGPT, all these kind of things are putting pressure on us, we're kind of seeing these fires happening, but we're kind of saying, this is fine, we keep going. And I think we need to start rethinking about what innovation might mean. And I think today's theme was really perfect for me to come in and talk about, because it's been the sort of space that I've been for the scholarship work that I've been doing. And so, you have a little bit of a black dots where there shouldn't be, but I hope that you can read some of the text here. That innovation rhetoric in higher education is really pervasive in terms of strategies that universities hold, the things that people want to be able to do in terms of educational endeavor. It's everywhere. But when it comes to actually looking at how they enact on this and how it's being researched and looked at, it's still unclear and under-investigated. And so Alice's work on the left, you can see, sort of provocates how innovation is still around us, but we need to be socially responsible. And it's our educational leadership challenge that we face. And so that is the essence of what I'm going to talk about today. And so it is a leadership challenge, and digital transformation and generative AI for education. These are the kind of things that are really driving this rhetoric and narrative. But we also work within this quite strict regulatory frameworks. Claire talked about the learning objectives and outcomes needing to be met in terms of accreditation bodies, pressure, and frameworks and so forth. And we also have this narrative around graduate employability. So students going through higher education qualifications needing to get jobs and contribute to the society, because we have this responsibility to make sure that the students are able to do that. But increasingly, what we hear from students is that the higher education qualifications, especially postgraduate degrees, are expensive, and people are struggling to make time in thinking about their career development and so forth and so forth. And so there's a huge range of tensions in terms of what we want to do to innovate our educational work and what the current context is for us to think about. Now, this is another context that I wanted to share in terms of where I work. So this Faculty of Medicine and Dentistry has 900 years of history. So we've been celebrating this since last year. So it started as a hospital in the east in 1123, and it was created as a hospital to look after the poor. So we really have this strong narrative in looking after the minority backgrounds, the underprivileged backgrounds. And so since then, even though it wasn't established as a university, the medical education in the way that see one, do one, teach one was done in the hospital. And then the college was created in 1785. And so I think this is, again, interesting context to think about where innovation is brought to the fore, that this level of history, 900 years, need to be really considered to then think about what we need to do for innovation. So me coming in as a Dean for Digital Education to do this kind of change and innovation work, I was hugely inspired by people from Edinburgh who have done this kind of work. And they talk about universities actually have the space and capacity to think about what we can create as a collective future in innovation. But we need to really collectively do this with hope and participation with others. And so that really motivated me to do this work. So when I arrived in this role, I launched this campaign called Discovery Towards Strategy. And it was sort of more of a 8 to 9 months in the end campaign to really listen to the community and work with people to understand the current lived experiences of teaching and learning online. And so this was part of the co-creation of the vision for the future in digital education. So this was another effort to do with making this listening exercise visible by the new leadership group to come in before we start making changes, to really acknowledge and appreciate the history, cultural context of what was it like to be doing teaching and learning online. And I was very conscious of the fact that people just have gone through really challenging time with COVID transition that they had to do. So in doing this, in terms of study design, I drew upon the appreciative inquiry, again, appreciating that this is the culture that they existed and that needs to be respected, and mostly qualitative research methods that really highlighted the lived experiences of those people who are at the coalface to do learning and teaching. And so I spoke to both students and staff. And in terms of data analysis, I applied the discourse and thematic analysis. So this is a little bit of a infographic that we created to do this campaign. And so after I arrived here in September 2022, I have done a series of consultation for online surveys and different formats.
Obrigada. Aqui também, nessa aqui.
And
Achei o botão
workshops and so forth. And then just last year, we launched a new strategy in terms of digital innovation project series. So in terms of the data collection, I have spoken to more than 400 people, so staff and students, both through online surveys and different types of meetings that I had. And the mural board, the screenshots that you can see at the bottom are the sort of outputs that I collected from those kind of interactions. And you can see in the picture that people came in face-to-face sometimes, and some people were staying online. So I offered hybrid modes as well, so that I can get as many people as possible into this consultation. So really bringing people on board. And I wanted to make sure working with students happened in terms of partnership. And so Sabir, who was a third-year dental student, worked with me as a paid work, but he really played a key role in doing the online survey design and also facilitation of workshops and so forth with me. along with the other people who are helping me to do this consultation process. And this is a link to the video. If you get the access to the slides, you'll be able to watch this on YouTube. And he's talking about how beneficial it was to work on this project, and also outlining the results of the online survey that we did. And it was a really rich insight that we heard from students in different forums. So this is a snapshot of the en vivo coding that I did. So all sorts of data sources that I collected, I put them all into the en vivo, and then did the deductive open coding, looking for themes. And what I found was really rich in terms of the insights. And subsequently, I published this report for the community, which really highlighted the opportunities and challenges, and also pointing to the future recommendation of work that needed to happen. One of the critical questions that I asked for the community was, why do we need to do this digital education in terms of thinking about the innovation? These are the 5 key themes that people told me. The strong value that was existing was the inclusion and accessibility. And so again, going back to the history of the St. Bart's Hospital being the space for looking after the poor, our university has a diverse background of students, really, really diverse range. And so this idea of digital education provides the opportunity to be inclusive and accessible in broadening access to education was really strong. And that comes with the flexibility. So in terms of the modality of digital education, people thought that this was really important. And also that authentic learning can happen. Again, we live in this post-digital world. Digital is surrounding all of us. And so in terms of the learning, students need to be learning in the virtual and digital way so that they will be prepared for the post-pandemic, post-digital world that they are going into the work for. Pastoral care was an interesting one. And I think this relates to that idea of the community and relational aspect of the education that people talk to me about, that it's important that digital education provides pastoral care and builds relationships with people. Last one, business proposition. Another interesting one, that if you think of the clinical education, the physical spaces are limited, as Claire just highlighted. And so online and virtual spaces are unlimited. In terms of thinking about the students' enrollment, we can go bigger and get more students in. And so people had this idea of digital education is also a business proposition for the university to grow and financially get better. I talked about the opportunities and challenges. These are the 2 sides of the same coin. I see them. And I don't think there's a lot of surprises here, but if I can pick up a couple of things, as I said, the human relationships was really important. A lot of people told me about, especially the relationship between the doctors and patients, and students and teachers, and also including the alumni. And so in the medical education, we really need to be relational. And that was the one thing that people talked about that was difficult to be doing for digital in online spaces. People found it challenging to build those kind of relationships, and that kind of community feeling was important. Digital engagement is another interesting one that I thought. It's not strictly educational effort, but people also talked about how we needed to have better digital presence to be able to communicate what we're doing, how we're working, and building relationships. And so it's the idea of almost promotional and digital marketing kind of idea that people thought as part of the digital education effort that we needed to do. When you think about the online programs that we communicate through websites, for example, there's a lot of opportunities people told me that we could be doing better. Last one, the supports. Claire talked about how quickly she transitioned in 2 to 6 weeks, which is impressive. But as she told us, there's a lot of surprise. The people didn't really have a lot of experience before. And so this need for capacity building with digital literacy in being able to use certain technologies but also creating the digital pedagogy support, so learning design, and drawing on from what works in the learning science. Can we apply that sort of evidence-based approach to doing this work? People didn't feel they had enough support from the university. And the last aspect of this support was also curving out the time. People are really just busy. And to do any kind of PDs, we need to give them support to create that space and time to do professional development, was what people were telling me. So based on this, I created these recommendations mostly around 3 key ideas. One is about digital education needs to be established as a professionalized expertise. And so that's what my team is really about, to then capacity and capability build of those people that we work with. And finally, this innovation project series that I'll talk about in a minute needs to be strategically placed for expansion of our online offering and also improving our practice of digital education. Another thing that I did as part of this report writing was to come up with the principles that would guide us in doing this kind of work. And I called it CARE principles. And you can see these 4 learning design principles that would be used as creation of the online programs in thinking about those aspects, but they're also to do with the ways of working. And so in doing this digital education work, we need to be co-creating this with students, alumni, and community members and clinicians. And also the learning is authentic and active. I talked about how learning needs to be relational in especially the context of medical education, and it needs to be evidence-based because there's a lot that's already been looked at and studied from the learning science that we can draw on. And this is really important when we are asking people to do a change. People are busy. We can't just be telling people to do something different just because we think it's a good idea. We need to be drawing from the evidence of what works really well. And I think it's a suitable thing to call care in the context of healthcare education. So we quite like it. I talked about the innovation project series. There are 2 arms to this. The first one is what I call CARE Agenda, which is essentially the digital learning program design and development work. And so we have now 6 programs and short courses that we are developing across 6 research institutes that we have within the faculty. And so it's this kind of strategic innovation project that I set out to then achieve these kind of goals that I talked about. The second arm is around digital assessment and feedback. Claire talked about how online exam is a challenge. I think this remains true to many institutions. And now we're bringing in Cadamus, which is the assessment for learning platform, as a catalyst to do authentic assessment design and transformation of feedback processes better. And so these are the 2 projects that we started to do based on that report that we did in listening to the community and understanding what really needs to happen. So the final example that I want to share, and then I need to do this quickly, Claire, because we're running out of time, is this MOOC course that we just launched on digital health. It's a funded project from the British Council, year-long, that we did with Ain Shams University in Egypt. And it was really built around the narrative of widening participation to digital health education. And it's running now for free if anyone is interested. I drew on the triple helix model of innovation as a conceptual framework, and we applied the classic learning design principles of social learning and community of inquiry. And we worked really closely with the team in Egypt to do this. And what did we learn? The outcome was quite overwhelming in that we, in the first months after the launch, had 2,600 plus enrollments and global learners joining us from 100 countries, mostly coming from Egypt. And what we also identified was this need for something like this on digital health to be embedded within the core curriculum of medical education. And a lot of the students from Egypt also talk about how medical education is packed and there's no space for thinking about digital aspect of the practice in medicine, and this was really, really helping them. And so we learned a lot about understanding our cultural partnership and the differences and similarities in the practice of digital health, especially issues around digital divides and inequalities that we highlight in this course. And we needed to have this courage and acceptance to think about innovation and actually do this work together when things haven't been done before, and we needed to manage risks also. And so I run this very quickly, Claire, given the limited time, but I'll stop here and hand it back to you.
Claire, you're on
Okay,
mute.
thank you very much. That was fascinating. I mean, two excellent presentations, and I think that we've got a little while for a discussion. I know that one or two people are likely to have to leave fairly shortly, but the discussion will be on the recording. So, Matt, you appear to have a question, unless it's just a comment about timing. But there have been a few questions in the chat. I'd like to start by raising, unless anyone's going to raise their hand immediately, with a question that's come up in response to both talks, which is the whole question of accessibility. If both of you could reply quickly as to how, if at all, you've been able to make your online educational offerings of various types accessible to students with disabilities, but possibly more particularly in this case, students with in resource poor environments with limited bandwidth and limited technology.
I could take that first, Claire, if you like, and jump in. So I think accessibility is a really critical issue for us to grapple, and you can think of this, I tend to think of this in two ways. First is the general idea of access to education and widening participation narrative. And so that MOOC on digital health that I just shared is around that. And so we can make something like massive open online course, which might not be otherwise accessible to those students who are in the lower income countries. We can make education more accessible through digital education. That's one. And then, of course, accessibility in terms of the technical aspect of people being able to access all the learning materials to do the progress of learning online. And for MOOC, we really made sure that everything was accessible. And this is a specific skill set. And I have to say, not all educators or people who are not trained to understand WCAG AA standards, for example, can do this. And so we need to bring in specific expertise of people to be able to do this for environments like MOOC. And so therefore we have a luckily interactive web designer who understands accessibility, compliance issues and so forth. But for online programs within the university setting, this is something that we really need to work with people to raise the standard of what we can do. And there's a lot of easy fixes that we can do to make it accessible in LMS and online environments. And so there's a lot of capacity building that needs to happen, I think.
Yeah, no, I agree, Chie, absolutely. That was one of our biggest sort of issues, was this whole bandwidth, even with students, you know, sort of locally, it didn't always work. I mean, the fact that we're online now does mean that we are reaching the students in the LMIC, so that just feels that our course has become so much more accessible. Now it's not in person, but the whole data and the size of the files is something that I think you do need a specialist for, so that you can, from our point of view, was keeping that resolution, using different tools to sort of balance the resolution with keeping the bandwidth, keeping the file size small enough for everybody's bandwidth. So I think there's definitely more work to do from our course for definite, but I think it needs an expert.
Okay, thank you very much for that. That's a great answers to that question. I've got one question in the chat more specifically for Chie, and that is in relation to the extraordinary speed in which Clare moved for her course. How were you able to take such a logical and sensible approach to digital course development in view of the fact that at the beginning of the pandemic, everything had to be done in such a hurry?
Well, really interesting question, Claire. And I was heavily involved with that huge online transition in Australia. And so I was in a context where 65,000 students moved entirely online in about 2 weeks. And I was the director of digital learning then. And so I saw a lot of great work of people trying to transition, and a lot of innovations like Claire's happened. But then to shift to come to this kind of a new university that had 900 years of the history within the faculty, I really had to be careful in bringing on the narrative of change and innovation. And so after the pandemic, I came in 2022, appreciating that people had such a challenging time. To bring on new change, you need to bring on people along the way. And therefore, this campaign called Discovery Tours Strategy, to create this sense of co-creation, and that people had the agency to do this change and innovation together with me and my team. And so it was sort of a important part of the work for my role, to then be able to do this online program design and delivery more carefully, to build on the kind of good work that happened through the pandemic. I don't know if that answers your question or people's question here.
Thank you both. That's again been fascinating answers and replies to fascinating presentations. Another thing that seems to have come up in a number of the comments, not only in the chat but also something you both mentioned in your presentations, was that the need for the professionalism in the digital educational professionals, the need for, if you like, perhaps a specific profession. Certainly, the skills and expertise of digital education professionals being taken perhaps more seriously than they often are. And I don't know if either of you could comment on that.
Oh, yeah, you're absolutely right. I think this is pre-pandemic. I will admit that there was, digital technology, digital learning out there, and I was very much like, that's not something I do. I do very much hands-on, and that team are probably very nice, but I don't need to engage with them. They're fine. I know what I'm doing. I'm in a lab. But having now been through this, teach yourself how to do video editing, you really, really need the help of those professionals. And I think that almost we should all be engaging with digital learning now, but it needs time. That was the other thing. I never had time. I didn't, I was going to do a lab practical. I didn't need that. I didn't have the time. I was too busy. So Chie's right in what she said. You need to give people the space and the time and the support, and you have your professional team to do that. I think that's perhaps where we really need to be going, is giving educators the time to transition and to include digital learning as sort of part of the norm and not something extra.
Okay, well, it's nearly 3:10. I'm wondering if it might be sensible to wind up soon. I know people are likely to have other things to get away to. So does anyone have, but either the speakers or perhaps Anita from LSHTM or anyone on the call, have any final comments to make? We can allow a few minutes for this.
I think I've really enjoyed both presentations. They've been really interesting. And I think, as has been highlighted already, what really sticks out to me is that we've got a growing need for that professional person to do that, putting the academic material into the space that actually the students can get the best benefit out of it. So can I add my thanks to everybody else, to both of you? Thank you very much.
Okay, any final comments from our speakers?
It's been wonderful. Thank you very much, Claire, for expertly chairing this session, and the other Claire for sharing a really great example of what the innovation looked like. And it's great to hear it's continuing. And the forum always at the core is fantastic, isn't it, to hear from different people. So I'm really pleased to be part of it. Thank you.
And thanks from me. It's been a real pleasure to talk to people about something that we were kind of forced into, but has changed our course and certainly my opinion of digital learning. And thanks to Chie for really interesting and sort of highlighting that we need the kind of foundations to support all this work. And thanks very much, Claire and Anita, for the invite.